Temperatures rising on Capitol Hill, not because of global warming. The senators sparring over health care at a Senate finance meeting earlier. Listen to this.
After being told if you like your policy, you can keep your policy. If you like your doctor, you can keep your doctor. And touting the great benefits of the Affordable Care Act, most of the Democratic presidential candidates want to eliminate private insurance. Eliminate it for 180 million people.
How the hell can you say you support protections when you had all the power and a bill did not pass that would replace the Affordable Care Act? I'm still waiting for the replacement. You've had 8 years of belly aching about it, and you haven't done a damn thing about it.
Here now is Republican Senator Bill Cassidy. Senator, you were there. How would you respond to that?
I would say that both right and left agree that the Affordable Care Act is broken. When the presidential candidates are speaking of Medicare for all, what they're saying is that the ACA has failed. Now, there is a different approach. Republicans want to give the patient the power, but Democrats want government to have power over the patient, to take away your insurance, to double your taxes, to deny you the doctor you wish to see. Now, I do think in that exchange, Senator Casey is more interested in an issue than he's interested in a solution. Republicans are interested in solutions.
Congressman, I want to talk a little bit on the political side. Senator, you have a big re-election coming up next year, and it seems to me the marketing of this, the last election, the Republicans lost on the health care front. Do you all realize that this is a big deal as we go into next year, and the loudest and soundest voices will win, and you're up against people that are now calling for basically the destruction of health care and the insurance industry?
Gary, this Republican knows it. I worked in Louisiana's charity hospital system for 25 years. I understand that families are still sitting at the kitchen table wondering how to pay their medical bills, and Obamacare has made it worse, not made it better. And I'm all about Republicans having a plan to bring forward that meets that family at the kitchen table to lower the cost of health care, to lower their premiums, and I am actively working on just such a plan.
Senator, forgive me, I'm a little skeptical when I hear two phrases together, government and lowering prices. Don't you agree that the best way to lower prices eventually in any market, health care or anything else, is a free market? And yet, by arguing one form of government versus another, we're getting further and further away from that. Do you ever see us getting to a free market in healthcare where you can lower prices, just like we've done in plastic surgery?
So, Gary, you and I are on the same page, but I'm not sure you understand where I'm going. One thing I've been advocating is price transparency. The only way price transparency will be forced upon the people who are currently making money because we don't know the price is by government mandating that you publish the price. President Trump is doing just that. I have legislation, which is, by the way, bipartisan, so folks on the left recognize this, that you would also publish prices for drugs, for services, you name it. That can lower prices. That's giving power to the patient.
Senator, it's Christina Partsinevelos here. You just talked about lowering prices. Your committee actually passed a new bill today to do just that. But you're talking about it, and yet you voted against it. Tell us why.
No, I voted for that bill.
Oh, you did? Okay, so then to that point, then how many people do you find that didn't vote towards it, and what was the argument against it, given the fact that Americans are spending $1,200 on average per year on prescription drugs, the fact that just 6 months in 2019 alone, we saw the price of drugs increase 10.5%, much higher than inflation. What do you think of all this, given that you're a doctor?
6 or 7 people voted against the bill. There is a provision that caps the amount of subsidies drug manufacturers will receive if they increase the price of the medication faster than the rate of inflation. For those folks, they felt it was price setting. I don't think limiting how much the federal government gives as a subsidy is price setting. It is limiting how much we subsidize, and that is a fair thing for we, the people, to do.
Senator, thank you for being with us. Got kind of a cheeky question for you, sir. You mentioned you have a plan for health care. Where in the Constitution, sir, could you point to and where it says anything about the federal government having anything to do with health care, whether it be health insurance or drugs or anything else like that? Where in the Constitution do you find that authority, sir?
So obviously the Constitution does not specifically speak of health care, but if we're going to fight that battle, let's go back to 1964. And let's say, okay, Medicaid and Medicare, and before that, back to 1919, the VA, or whenever the VA started, let's go back there, and you will see that there is a discussion that took place in our history that said that de facto, we're going to have an interest in people having access to health care. That's where we are now.
Senator, I'm just curious, do you think that the push for lower drug prices will go beyond what you say? That is, you're saying it'll just mean less subsidies for Medicare patients, that it might get into price controls. And if it does, and if it's initiated by the president, would you vote against that?
So I do not think there'll be price controls. Democrats want direct negotiation between the government and the drug manufacturers. I'm opposed to that. The government would have the monopsony power over many of the medications, would be able to dictate a price. It would be too tempting to dictate a price too low that innovation would be squashed. I don't want to squash innovation. I want innovation, but nor do I want the taxpayer being hosed.
Senator, they're asking me to go. I have to ask you a very quick question. You became a doctor years ago, decades ago. Knowing what you know now about how messed up the system is, would you go to be a doctor if you just got out of grad school?
Medicine is one of the greatest fields in the world. You have the honor of serving a fellow human being to restore them to life and to wholeness, and there can be no greater privilege.
Good for you.
than that.
It's a real vocation. Thank you, doctor. Thank you, Senator. Good to see you both.